For the economy as a whole, the coronavirus has been catastrophic, and that includes the part of the economy that delivers social services. In the state nonprofit sector, that means everything from cutbacks in services and revenue to problems for employees. To tell us about a recent survey on the impact of COVID-19 is the CEO of the Massachusetts Nonprofit Network, Jim Klocke. Thank you very much for being with us, Jim.
Oh, Chris, you're welcome. Glad to be here.
Jim, this survey goes back maybe almost a week now, and almost all the response said the effect has been severe or moderate. What does that mean?
It means a few specific things. The first impact, we heard about this immediately, and it's continuing. This is going to significantly constrain fundraising for nonprofits. We know from experience, fundraising is the lifeblood of nonprofits. We know that this time of year, March, April, May, June, fundraising events, fundraising galas, fundraising drives, those are all significantly limited. And so the nonprofits we hear from expect a significant revenue drop as a result of it. The other big challenge is simply delivering the services. In some cases, if an organization usually has customers, clients coming into the office, that can't happen. If you're an organization that sends professionals out into the community, into people's homes, into people's schools, that can't happen anymore either. So nonprofits are trying to find new ways to deliver these services. And as employers, like everybody else, we are dealing with the challenges of working remotely, keeping up on top of things, keeping connected to each other and to the people we serve. And it's a daily challenge, but people are stepping up.
I want to talk about an essential service like daycare, or at least ordinarily that would be essential. ABCD
Yes.
runs Head Start programs all over the place. Yes, a lot of children are home with parents right now, but what about the workers? What's going on with them?
Well, in many cases, the workers are working remotely and so delivering services remotely. The explosion of video calls and video conferencing, as with this interview, is also happening in a lot of organizations that work with clients. Medical appointments, teaching sessions are now happening online. It's a good temporary solution, although it's not accessible to everybody. People with low incomes, people with limited internet connectivity are in an especially difficult position. I think where nonprofits can continue to deliver services the way they always have, they're doing that full stop, but in many, many cases, they've had to adapt.
What about people who go to nonprofits for mental health services or dealing with substance use disorder? If they can't get service person to person, how much of a difference do you think that makes?
I think in some cases it does make a difference. We wish that service could be delivered completely and fully in any environment, in an online environment as readily as an in-person environment. I think the reality is, for some people, online service delivery will be very helpful. For others, it will not be as helpful. And so the other thing that we're asking everybody to do, reach out. If there are people in your family, friends who you think need that boost, need that phone call, reach out. If you're thinking, how can I help? What could nonprofits ask me for? The first ask is financial. Because the fundraising crunch is so severe, we are asking people to make any donations they can. And then people also ask about volunteering. While it is true that a lot of in-person volunteering opportunities are on hold, there are some organizations that can utilize volunteers. Maybe it's doing some work online, maybe it's helping via video. If you have a question about that, contact the nonprofit that you're interested in. They can give you an answer. But again, the first need, the foremost ask for nearly everybody is fundraising at this time.
Now, some of the agencies that we've been talking about might get their funding even primarily from government sources, but what about other nonprofits where the sources are more in doubt right now? Any examples you can give?
Well, I think, frankly, we hear from members, most of our members rely on multiple funding sources. So there are an awful lot that are getting some funding from the government, some from fundraising, some from earned income. Earned income revenue is especially constrained right now. If you have organizations that have charges, co-payments associated with an after-school program, associated with an educational program, in some cases associated with certain types of healthcare services, those revenue streams have, for the most part, dried up. On the government funding side, we're in touch with leaders in government all the time, and they understand that at this point in time, there are an awful lot of organizations that can't deliver services the regular way, but still need their funding, still need to keep the organization going, still need to pay people. And so in those cases, there's dialogues going on with people in government. I think people in government want to be as helpful as they can, and we're working with members and governments to try to see that that happens.
And of course, with community health centers, they're nonprofits. They're going to be very busy, maybe handling people who have COVID-19, but they've had to cancel, at least postpone, a lot of other appointments that bring in revenue. So, where do you think that leaves them?
Well, there's no doubt that that's very challenging for community health centers. We're all waiting eagerly to have this big federal stimulus bill signed. That will bring a lot of money to Massachusetts and everywhere else, including for healthcare needs. There's one other issue that affects community health centers and a lot of nonprofits, and that relates to unemployment insurance benefits. A lot of nonprofits actually self-insure their unemployment insurance benefits. Technical term, net result of it is that at this time in this crisis, that is creating a new cost burden for them. We are working to try to alleviate that cost burden with partners in the community health center area, with partners in other social services and other nonprofit fields. There appears to be some relief in this new federal bill, which again, we're waiting for the signature on that. And then the question is, can we do more at the state level to help community health centers and other nonprofits in that particular circumstance?
Well, we have the governor trying to help out with the disaster declaration, the efforts going on in Washington. What about what's being here? Mayor Walsh has been working with partners on a sort of a philanthropic fund to get people through things here. How do you see that helping the nonprofit sector?
Well, that's been terrific. And one of the best things about that was that that came together very quickly. There's actually a few parallel efforts going on in Boston. The fund, as you mentioned, that Mayor Walsh and civic leaders set up. The Boston Foundation has also launched a separate fund expressly dedicated to providing some financial support for nonprofit organizations dealing with all these challenges we're facing. And I will tell you that effort is being replicated across the state. Community foundations all over Massachusetts, United Ways all over Massachusetts have set up new funds trying to raise new money to provide help for the people and the organizations that are the most adversely affected by this crisis. And so we are heartened by that. As I say, it came together very quickly. That's another place if people want to consider donating. We ask you to get in touch with your local United Way, with your local community foundation. They are mobilized. They are ready to accept donations, get them to the people and the organizations that need them the most. And these kinds of partnerships between the mayor, between leaders in Boston, between funders, nonprofits, they're happening all over Massachusetts, and they're just what we need.
I want to come back to one of the things you mentioned earlier on, and this is about the effect on fundraising. It would seem that you could send out information online and people could pay just like going to Amazon.com, give you the money. But fundraising has traditionally been events where people gather. Why is it so important to do that with people coming together?
Well, there's no doubt that the most powerful type of communication, interpersonal connection is person to person. It gives you the ability to connect to, read to, relate to each other in really profound ways, but it's not an option right now. So some of these fundraising events are going online. People are getting very creative about putting their fundraising events online. And in addition, what we're hearing, what we're seeing, people understand that there's a big problem in the sector among people in need. People want to help. And I think at this time, everybody who wants to help is willing to do that help in a different way, is willing to make an online donation that last year you might have made in person, is willing to reach out. Yes, go ahead.
Well, yeah, because I was going to say, one thing I've noticed about some of these gatherings, I've never written a big check, but I've always admired them as an encyclopedia of community connections. Isn't that important to nonprofits?
Hugely important, hugely important. That's one of the other things we're missing right now. I think people are also getting creative with video meetings and video events. We know of some platforms that enable you to, put 100 people in video screens and try to connect them. And one of our hopes is that out of this, that technology will improve. Again, a substitute, not a complete substitute for in-person, but a substitute. One other thing I'll just mention, Chris, on the fundraising front. We at MNN have made our directory of nonprofit members available online on our website. If you Google Mass Nonprofit Network, Mass Gives, we have a page called Mass Gives with links to our database. So if you're trying to find a nonprofit to donate to, you can do it that way. Another excellent web resource is guidestar.org. A lot of information out there if you're trying to identify a nonprofit that you want to help.